So, Cheryl, what do we do if our loved one just does not want to have this conversation with us? I mean, this is, I've seen it with my own family. They don't want to talk about it. How do we deal with that?
It's very important that you say very low key what it is you think might be a good idea for us to sit down and talk about. And if they just say, absolutely not, I'm not going to do that, you want them to have a chance to digest it. So don't just act on that.
Okay.
Don't react on that. Let them digest those words, because we're hoping the words weren't critical, that they were just a suggestion. Because I see families who come in and it's a little critical of what I've noticed about you, Mom or Dad. So you really don't want to have it get off on that foot. Don't be discouraged because they say no. Just think, put yourself in their shoes, understand, because you should have been thinking through what would happen if they said no and what would be some of the things on their mind. And think again about the points that you wrote down to think about before this conversation. Make sure that you, again, are not losing your focus. You're not reacting to, oh, here goes Mom again. She's never going to agree to anything. Well, you've got to stop thinking that way and really make her or your dad feel that it's something you want to do. Don't say, I feel, and it would be better for me if you would consider this and do this. Don't do that. Keep going back to the words of, my concern is for your safety, your health and welfare. I want you to feel comfortable in your own home. I've observed that you actually might not be as comfortable. We've been talking about some things that make you uncomfortable when it gets dark. So just say it the way I just said it, as opposed to, now, Mom, you know, we've talked about this before, and you are not comfortable in your own home. That's gonna stop things up.
Okay.
Talk about happy things. You know, when parents are well taken care of, and they do feel comfortable in their own home, there's less stress. They aren't saying to you, I'm stressed. They don't usually use that word, but it is very stressful for them. It's part of why they're not eating correctly.
Right.
There's all kinds of things that are happening because they do need help, but they haven't recognized it yet. They are in denial because it's hard to face the changes that are occurring. Loss of independence. I mean, they think, I'm just losing everything. And of course, if it's on the horizon that they might not be able to drive, that's tough. That's really tough.
That's a big issue.
So I suggest to people that should be a point somewhere in there when you get to it, when you're actually in the conversation. Don't make that the first point, because you're just going right in there and doing exact opposite of what you said the goal is. You're going to take something very important away from them. You may know in your heart it has to happen here shortly, but again, make them feel comfort in their environment and their surroundings, and to really appreciate someone coming into their home is really going to just fill a little area that makes it easier for them. Laundry. Sometimes they don't do their laundry because they can't. They don't cook because they're fearful they can't run appliances safely. Those things are really, really important. So keeping to the point of making sure, did you ask them first, what is most important to you right now, Mom? And what is your biggest fear right now? And just listen.
I'm sure that makes a huge difference for them too.
It does.
Excellent.
It does. Because when was the last time anybody asked them that? They've always been judging and telling them the direction they need to go.
Right. Right.
So ask them, and ask them more than once.
Okay.
So they will eventually really open up, and you may be surprised.
Wow. Cheryl, thank you so much
You're
for this
welcome.
information. It's so important. In fact, I think we need to have you back and go into more detail on some of these things for our viewers.
Yes, there is some very specific instances that I think are good for people to think about.
Okay.
And not take it for granted that once you decide something has to happen with mom and dad, that you just make it happen. And it's difficult. It's really, it's difficult. And so you want a partner. This needs to be a kind of a care team decision, if you will.
Okay. Cheryl, thank you so much.
You're welcome. Thank you for having me.
Absolutely.